So Dr. DeCubellis here. I want to go over something that doctors will not tell you most of the time, and that has to do with pain. When it comes to pain, they don't really explain why you have the pain or what's going on. So I want to take a minute to kind of explain why we have pain. So pain is your body's way of telling you that something is not functioning the right way, and because of that, we're causing pressure or increased irritation of nerve fibers in that area. So what that means is that where you have the pain is where the most amount of pressure or abnormality or abnormal movement is happening. I did not say that's where the biggest injury is. So here's what I mean by that. We could have an injury up here that's causing you to move like this to take you out of pain. Because of that, you're walking with more pressure on your lower back, and after a week now your low back's killing you. That's where you feel the pain because your body has moved you out of the painful area up here, even though this is where the injury is. So you might feel more pain down here, but this is where the problem is. That's why doctors a lot of times don't like to explain things in too much detail because they don't want to do too much digging on an area that you didn't necessarily complain about. If you walk into the doctor's office and you say, I have low back pain, they're looking only at the low back. That's completely different than what we do here because we understand that the whole body functions together. It moves together. The movement patterns have to play off each other, and your biomechanics are of the utmost importance to making sure you heal the right way. So we have to look at everything. If there's a low back issue, we're going to look up at the middle and the upper back too to see if there's anything going on there. If we have something bending, curving, or moving abnormally, we have to get that moving the right way. And this is why a lot of times, and this is actually a good thing, a lot of times when we start working on patients, they'll notice that the pain starts to move around. This means we're having an effect. We're changing the movement patterns to get them back to where they should be. So because of that, we're feeling pain in different areas. Now, when it moves around, it's getting less and less each area it moves. So again, that's good, but moving around is telling us that we're having an effect with the treatment, and the treatment is geared to the right area. So that's kind of what's going on with pain, and that's why you don't get a definite answer sometimes when you go to the doctors because they don't want to look at the whole body. They don't want to look anywhere else than where you have it, and if it doesn't jump out at them or if it's not something they can treat right there in the office, they're not going to want to get into too much detail.